Okay.
Good afternoon, everyone, and welcome to our next session, which is the panel discussion. It is the hottest topic right now in the country. Congratulations, everyone. We've made it to near the end of 2020. In the past months, we have lost countless lives. We have lost billions of pesos as a national economy, thousands of lives, so much suffering. So right now, we will ask ourselves and our panelists, as a country, how are we faring in our COVID-19 response? This is in present tense because we're not yet, we cannot judge ourselves yet at this point whether, we have done it or not because we're still in the thick of things. We are joined by five panelists who have graciously taken their time to join us this afternoon. They will be representing different sectors of society. For the first question, so the flow of this will be, I will be introducing each of our panelists, and then they will answer the first question after I call their names, okay? So our first panelist is Dr. Jose Jonas del Rosario. Hold on, let me share the screen. Oh, there it is. He is a clinical associate professor of the UP College of Medicine, a coordinator for public affairs and spokesperson of the UP PGH, an interventional pediatric cardiologist, a TOYM awardee in medicine for 2004, and a consultant in major medical centers in Metro Manila. This afternoon, he is joining us as a patient. So Dr. Del Rosario, can you please answer the first overarching question? How are we faring as a country in our COVID-19 response?
Hi, good evening or good afternoon to everyone. It has been 9 months. I work in PGH. We are the one of the COVID-19 referral centers. If I look back in March, comparing March to now, I can say that we had significantly learned from our mistakes before, as it was something new. I think we have managed taking care of patients coming to PGH. Our numbers are much lower. The doctors are more knowledgeable taking care of the disease. Our healthcare workers, although they're still stressed, I think their stress level has gone down too. Because after a while, people are getting used to taking care of COVID-19 patients.
Thank you and good afternoon, Dr. Del Rosario. Our next guest is Dr. Rabindra Abeyasinghe, is the WHO representative to the Philippines. Prior to that, he was acting director of the Health Security and Emergencies at WIPRO, based in Manila, supporting the regional response to COVID-19. He was coordinator for malaria and other vector-borne and parasitic diseases at WIPRO, and has served WHO since 2011 in various capacities. So as a public health practitioner, what can you say about how we're doing right now as a country, Dr. Rabi?
Thank you and good afternoon. It's a pleasure to be here and a very warm welcome to all of you who have joined this session. We are probably midway in our battle against COVID. Not quite sure whether we are yet at the midpoint. This is clearly a marathon. We could be optimistic that we are probably at the midpoint if the vaccines work and we can get them out for everybody. But let's look at the question, how are we faring as a country? That's a complex question because we need to look at it from different angles. We need to look at it, how have we done as a country? How have we done in comparison to other countries? And what lessons have we learned? How can we improve what we are doing currently? Recognizing that this pandemic is not going to go away in the next few months. So how have we done? I've said this before, the Philippines was very proactive in having Luzon-wide lockdown early in March, I believe March 14th. And that gave an opportunity to expand a diagnostic system which didn't have capacity to test even one sample. Now we are beyond 100 labs, molecular labs that can do RT-PCR. We have used the time of the ECQ. The government has expanded its hospital care pathways. It's provided PPEs, trained healthcare workers on IPC. And as Dr. Rosario just mentioned, it has provided an opportunity for the clinicians to improve their skills on managing patients. And so if we look at it, we are now assuming our first case was on the 31st of January here. We are now into 11 months of the pandemic. You have, I'm sure Vergeire will give the exact numbers, something like 432,000 cases and 8,700 deaths. It seems a lot, and I'm sure Professor Winnie Monsod is going to talk about the huge economic impact it has done, this pandemic has caused. But we have been working with the government to both minimize the health impact by protecting lives and minimize the economic impact. So as I said, the early lockdown probably prevented tens of thousands of cases and probably many thousands of deaths from happening. We have to recognize that, because that was the opportunity that the country built its capacity. We've said right from the beginning, this is a new disease. We didn't know what we were dealing with. And as Dr. Rosario also just mentioned, over the months, we've managed to improve how we understand the disease and how we respond to the disease. So a country of 110 million people, 430,000 cases, 8,700 deaths, I would say you are performing well. If you look at it from a population perspective, the Philippines has the 12th largest population, but from an absolute number of cases, and we don't go by absolute numbers of cases, but if you look at the absolute number of cases, you're 27th on the global list now. Although for population size, you're 12th. So this is evidence that you are doing quite a good job. But as I said, we don't go by the number of cases because different countries have different testing capacities. And we have to acknowledge that the Philippines having a testing capacity of, I believe it's like 52,000 tests per million population now is reasonably high. And so we have seen that all that effort in the early months is now paying off with a relative stabilization of transmission in the earlier hotspots. I'm referring particularly to Region 7 and Cebu, but also to NCR and to some extent to Region 4A and Region 3. Of course, as the pandemic evolves, we will see the virus moving into other parts, and that's what we see now with a surge of cases in Davao. But again, the country has been investing and expanding its capacity. So overall, that part of the response, we could say, has been satisfactory in the fact that we've limited the number of cases to less than 500,000 and the number of deaths to 8,700. But let's step back now and look and see whether we could do things differently. Can we improve what we are doing? So as I mentioned, we have made progress, but as WHO has been saying from the beginning, we can restrict the transmission of this disease and suppress transmission pretty effectively with the tools we have, even while we wait for a vaccine or a clearly effective therapeutic agent. So the recommendations that WHO has been issuing on early diagnosis, early contact tracing, isolation, quarantine, and management have been used by other countries to actually achieve better levels of suppression of transmission. So
Thank you, Dr. Rabi.
therein is
Yes.
the point that we say that there is still opportunity for us to use this stabilization of transmission to further suppress the transmission. We need to do that because as we go through, and many of you are aware that right now Europe is experiencing its second wave, and its second wave seems to be even more deadly than the first wave. So we must make every effort in the Philippines to prevent that kind of second wave happening. And it's about empowering the population, keeping them aware of the need for physical distancing, the cough etiquette, the hand hygiene, avoiding the 3 Cs that we've been emphasizing right from the beginning. Even if it's the holiday season, even if it's the Christmas, even if it's family time, this is in the middle of a pandemic. So we have to recognize this, we have to message this strongly, and we have to make sure that we use every opportunity we have to further suppress the transmission. If we do this, and we can do it, we can suppress it more, the likelihood of a second wave will become less. So as I say, while we have done relatively well, there's still room for improvement. We need to still accelerate our time span from symptom onset to detection, to contact tracing, to isolation and quarantining. If we can do those, if we can clearly identify the avenues of transmission, where is the transmission happening, if we can educate the public on those to avoid those settings, I believe that we can even suppress transmission further. So the message is we can do better, we have capacity, we need to be encouraged by what we've achieved and try to take it to a higher level. Thank you.
Thank you, Dr. Rabi. So we're in the middle of the pack. We're not doing too bad, not doing too shabby, but we can do better. So that's the opening salvo there. For our next guest this afternoon, she's going to wear her social scientist hat. And I say hat because, you know, if you want to find her at UP Manila, you need to look for her the hat, because she's the only one who wears a huge hat, colorful hat. She's a health social scientist at Professor 5 of the Department of Clinical Epidemiology at the UP College of Medicine, a member of the WHO Social Science Working Group in COVID-19, affiliate health social scientist of the Institute of Clinical Epidemiology of the National Institutes of Health UP Manila, a co-investigator of the Life Course Study on Cardiovascular Epidemiology, and a member of the Philippine National Health Research System. Ladies and gentlemen, please help me welcome Dr. Nina Castillo-Carandang. Hi ma'am, good afternoon.
Maraming salamat po sa PSMID sa paanyaya. I ask permission to speak in Filipino and also lapse into English. Isang malugod na pagbati po sa lahat ng ating mga frontline workers, lalo na po sa ating mga kasama sa kagawaran ng kalusugan, nandito po si Yusek Roset, at sa mga healthcare professionals. Nais ko din pong magbigay pugay sa aking namayapang kaibigan, si Dr. Salvacion Rodriguez Gatchalian, dating Pangulo ng PSMID at aking katuwang sa pag-aaral ng TB sa mga batang Boholano. If healthcare workers are indeed our new heroes, we need to really take better care of them. Maraming salamat po sa inyong serbisyo at sakripisyo. Let me quote from Charles Dickens. Now, Charles Dickens wrote the book A Tale of Two Cities in 1859. And what did he have to say? It was the best of times. It was the worst of times. It was the age of wisdom. It was the age of foolishness. It was the epoch of belief. It was the epoch of incredulity. It was a season of light. It was a season of darkness. It was the spring of hope. It was a winter of despair. Year 2020 literally started with smoke and fire. We had the Taal volcano eruption and went on to repeat declarations of states of calamity for swine fever, typhoons, floods, COVID-19. This year has also been peppered with controversies, the good conduct time allowance, POGOs, Pastilla scheme, denial of congressional franchise, PhilHealth, anti-terrorism law, red tagging, and crimes, unresolved killings, scams, cyber crimes, you name it, we had it this year. And as the year ends, we are still in the midst of COVID-19. The Philippine healthcare system has been severely constrained. We have inadequate financing, overwhelmed health services, weak governance and management capacity. Is the so-called longest lockdown in the world something to be proud of when it has resulted in more hunger, greater poverty, more unemployment, especially for women and those in the informal sector? The lack of a gender lens on COVID. There are more female healthcare workers, there are more males getting sick. There's more violence against women and children, more mental health problems. There's a neglect of non-COVID problems, poor access to education, greater divisiveness, a raging infodemic amidst growing distrust, and even greater inequality. So, how are we faring? You tell me. Or perhaps all the so-called SARS who epitomize the securitization approach to COVID-19 would want to have their say. My pleas for active risk communication and community engagement, greater participation of civil society and the private sector, a whole of society approach so that we can pivot to hopefully a better everyday. Not the so-called new normal, if it will still perpetuate inequality and injustice, which already have even before the pandemic. And please, please include real social scientists in the design, implementation, monitoring, and evaluation of our efforts to address COVID-19 and its impacts on Filipinos at the individual, family, community, and global levels. Maraming salamat po.
Thank you po, Ma'am Nina. So from Ados, from Dr. Rabi, I think that's almost a tres, Ma'am. I
Let's
hope we
ask our
don't...
SARS what grade they would give. I don't know.
I'm kind of scared because we might have to take a removals exam after Professor Monsod speaks. So thank you, Ma'am Nina. Our next speaker this afternoon, our panelist, is Professor Solita Colias Monsod. She's a professor emeritus of economics at the University of the Philippines School of Economics. She's a prominent educator, economist, broadcaster, writer, and political analyst, popularly known as Maring Winnie, but I'm not going to call her that for this panel session. Professor Monsod has been teaching at the UP School of Economics since 1963. Her commitment to teaching and public service earned for her the Most Outstanding Alumna Award for 2005, given by the UP Alumni Association. She served as the 5th Director General of the National Economic and Development Authority and concurrently Socioeconomic Planning Secretary of the Philippines from 1986 to 1989. Professor, how are we faring as a country in our COVID-19 response from an economist's lens?
From an economist's point of view, we are faring very badly indeed. There's no two ways about it. I mean, you know, the Philippines is going to experience the strongest contraction in GDP as far as Asian countries are concerned. We're going to have the strongest. At the same time, we seem to have the highest number of COVID confirmed cases in our ASEAN, and we also have the second highest deaths per million COVID. I cannot see how anybody can say we're doing well. We're doing well compared to when we started, naturally, because when we started, it was 0. So anytime you have 1%, that's well already compared to 0. But I'm talking about what the overall picture is, and the overall picture is not very good. As a matter of fact, just yesterday, I got a research paper that is going to be published in the Asian economic papers, written by, I'm glad to say it, my daughter, Toby Monsod, and another professor at the School of Economics, Corina Gochoco Bautista. And they are saying that essentially what I am saying, except that they have done an econometric study comparing 21 countries in Southeast Asia, East Asia, and South Asia, including Australia and New Zealand. And they're essentially, what they're saying is that we bungled it. First, we don't have enough capacity. As far as the international health regulations or SPAR is concerned, they used SPAR and IHR for their econometric study. And then they found out, for example, that if we had just better lab capacity, our growth contraction would have been 3.6 percentage points of GDP less than what it was. In other words, incompetence. Well, no, not incompetence, really. The fact is, we were not prepared, and it took us a long time to get prepared. And I don't know whether we are at this moment prepared. And the second important point is, so we know all this. We have the scientific basis for saying that our lab capacity, which is the proxy for the country's ability to respond to the pandemic, the point is that the lab capacity is poor, and we should therefore increase our expenditures on that. We should put all our money on it. And the paper goes on to say, well, looking at the 2021 budget, imbes na lumaki ang budget ng health, ay bumaba pa. In other words, considering we're going to need to have vaccines, etc., our budget for health went down by 28%, while the budget for infrastructure, mga public works, etc., went up by 48%. Now you tell me, folks, how can we explain this given the evidence that we are spending in the wrong places? That's the second point. The third point is at the same time, our what do you call that? Social amelioration program will be completely stopped. Our distribution of money, cash transfers to the poor, except for those who are in the conditional cash transfer program, will be completely stopped. We are stopping what we should be increasing, and we are increasing what we should be stopping. That's how bad it is. So it's not only the fact that we did not spend enough money, but we are decreasing the amount of money that we are spending, and that the amount that money that we are spending it so slowly pa. Ano pa? That's it. Those are my 3 points that I want to make.
Thank you, Professor Monsod. See, I was right. Removals time.
Oh,
What?
No, I mean, when we're in UP, right, you have to take removals by this point.
Well, I mean, when can we talk frankly?
Yes, I agree, Professor. And last but not the least, representing the Department of Health, is Dr. Maria Rosario Vergeire, the current OIC Undersecretary for the Health Regulation Team and the official spokesperson of the department. She was previously the Assistant Secretary in charge of the Public Health Services Team and Chief of the Health Research Division of the Health Policy Development and Planning Bureau. Undersecretary Vergeire has committed decades to public service, having worked in Marikina City's Health Office before joining the Department of Health in 2007. Aside from that, she's also committed to nurturing future public health leaders as faculty of the Development Academy of the Philippines and part-time faculty in the Ateneo School of Government. Dr. Vergeire, good afternoon. In your view, ma'am, how have we fared so far as a country? And maybe you can comment a little bit on the health budget being cut?
28%.
Good afternoon, everybody, and we'd like to thank the Philippine Society for Microbiology and Infectious Diseases for inviting the Department of Health into this forum. I also would like to recognize my fellow panelists, and good afternoon to all the members of FPSMID and our moderators. So first, I just like to say that I'm not saying that we had been successful already, but comparing from the earlier months of this pandemic, we already are seeing the decrease in the number of cases, and we have improved our health system capacity. When we look at that lens where we say if we are progressively improving or not, we look at two specific things. First would be the number of cases, and the second would be the health system capacity. So when we look at our health system capacity, we have improved tremendously. Just having one laboratory at the outset of this pandemic, we now have 186 laboratories. We only had 300 tests being done per day at the outset, and we were sending to Australia so that we can get confirmation. Now we have a total average of about 33,000 to 35,000 tests done per day. We already were able to test 5.8 million individuals as of this current date. And with regard to the isolation and quarantine facilities, we only started with one isolation and quarantine facility at the outset of this pandemic, and that was the New Clark City. And we only catered to repatriated Filipinos. Now we already have a total of more than 11,000 temporary treatment and monitoring facilities across the country, with a total of more than 26,000 beds. We already have these therapeutics and vaccines where we are undergoing different trials for the medicines, and also for the vaccines we are going to get into it already, trying to negotiate with different partners and also manufacturers. So at this point, where I have mentioned these improvements in our health system capacity, and we see the trend in the cases which are going downwards, I can say that these are good indications, and that I can also say that we were able to surpass these two surges that has happened in the previous months. But I am not saying that we are going to stop here. And we cannot be complacent at this point. Nothing is certain. We cannot also rely just solely on the vaccines that are coming. We need to continue on whatever we are doing right now. And yes, I agree with all the panelists that the capacity of government should still be further improved, like what Professor Monsod has said, improving more and having more laboratories, investing in that. We have 88 more laboratories to be licensed in the coming months. We also are still accepting laboratories and trying to have this purposive establishment of laboratories, especially in those areas which has no access. I just want to say that no country has ever been prepared for this pandemic. We are trying to cope. We cannot say right now that we are 100% prepared, but we are going to overcome this challenge as we have seen the engagement of local governments. So this is one of the things that we are proud that we were able to mobilize local governments, and that we were able to enable them to become these leaders in their own respective areas. And this has worked was very effective for government, that the local governments were able to lead their own responses and have that kind of leadership in their specific areas. We recognize in government that we still have a lot of weaknesses, and we have seen this because of this pandemic. The health system weaknesses were really emphasized, and we are trying to work on that by improving the capacity and by engaging all partners, not just the local governments. The private sector also has contributed so much, our academe, and of course our healthcare workers. So in the whole, I can say that there are good indications in this response that we are now currently implementing, but there are still a lot of things to be done. There are still a lot of challenges to be hurdled, but we are confident that we will be able to move this forward and protect the health of all Filipinos.
Thank you, Yusik Vergeire. At this junction, may I turn you over to my co-facilitator, Dr. Bryan Lim, for the House rules and to proceed to the next section of our Balitaktakan.
Yeah, thank you so much, Doc Kat, and greetings from Cebu. No, so Doc Kat is in Davao, I'm in Cebu, and all of you are in Luzon. So fantastic, no? So we just to remind the participants to please place your questions in the Q&A portion and not on the chat box, no? So we don't get confused. So I think now at this juncture, we shall not talk about the social mitigation measures of the COVID response. And as I always say, it's important to always focus on the why first before we go on the what and the how. No? So with that, I would like to call on one of my favorite professors in UP Manila, no? my dear Professor Nina Castillo-Carandang. Professor Nina, no? From the point of view of a social scientist, and I think it's very important, no, that you're right, that as you mentioned a while ago, that in the discussion and in the planning of all of this pandemic response, we need always a perspective of the social scientists. No?
Okay.
So the question is, what are the contributory factors that you think, why people sort of refuse to follow the social mitigation advice, including the minimum health standards? Why do you think so, Professor?
Thank you, Doc Bryan. I'm not sure about the term social mitigation. That's my first response to your question. I don't really think that concept is well understood. So can I rephrase the question, Dr.
Sure,
Bryan?
please go ahead.
And your question is, why aren't we seemingly following the rules? Yun ba?
Yes, okay. Yun po. As simple as that.
Okay, so we are biological beings, but we are social in nature. Especially pag Pilipino ka, nasa DNA mo yan, gusto mo makipagkulitan, balitaktakan, karaoke, tipon-tipon, lahat, harap-harapan. We are touchy-feely people, and we need that social contact to feel whole. We have a need to connect with others, and the social isolation, the quarantine, runs against our social as well as our livelihood needs, as Professor Monsod has pointed out. So the challenge is, how can we actually express and show malasakit and pakikipagkapwa sa gitna ng pandemya when we need to be physically distant? So there's that tension. And how do we incentivize behavior? By informing people about the consequences they care about. So when I receive queries, Nina, what are we supposed to do? I said, assess your risk po and assess the risk of those you interact with, and see whether it's really worth doing what you want to do. And if you're ready to face the consequences. So for example, we want to protect parents or children, the elderly, immunocompromised people from infections. But behavior change is not easy. It depends a lot on your personal feelings, your taste, your opinions. For example, COVID-19. There's a tension between panganib versus kaligtasan, danger versus safety. There's a tension between ginhawa versus kakulangan ng ginhawa, comfort versus discomfort. There's a tension between pagtitiwala versus kawalan ng tiwala, trust or mistrust, especially with regard to the government. Behavior change does not just happen in an instance. And making a lasting change in behavior is rarely a simple process because it requires a lot of time, effort, and emotion, and it takes place in stages or in phases. As we've all said, nobody was really prepared for COVID-19. So we also need to realize that behavior change, which is needed to address COVID-19 and to respond to it, also takes time. And what are the three most important elements in changing behavior? One is the readiness to change. Do you actually have the resources and the knowledge to make the lasting change successfully? Are you getting the right information about COVID prevention? Barriers to change. Is there anything preventing you from changing? And the likelihood of relapse or going back to the old behavior. What might trigger a return to the old behavior? What we found out, which doesn't work, is fear. Your mother wagging her finger at you doesn't really work after some time. Severe punishment also doesn't work out well, like the ex-soldier who was killed by the police at the checkpoint. What needs to be balanced? The costs and benefits of the change, the rewards, the praise, the incentives versus the punishments. What rewards are perceived to be of value to the target population? I always watch Mayor Isko of Manila intently. He gave 100,000 per barangay incentive for the barangays which had 0 cases for a certain period of time. I'm not sure if he's continued it, but it actually led to a decrease in the numbers because he gave a cash incentive, and cash was what people wanted as the reward. Is it sustainable? Probably not. But at least it got the message across that if you do the behavior which we are advocating, you might get a reward. We all like rewards. There's also the aspect of self-efficacy. Kaya ko ba to? Ang hirap-hirap naman ng pinagagawa. So we lose our sense of control over our life and our destiny. Let me end by questioning the narrative of pasaway na Pilipino. Is it true or false? Pasaway nga ba ang Pilipino? I would like to throw the question to the panel. And just using the example of Manyanita. Pasaway nga ba ang karaniwang mamamayang Pilipino o mga taong makapangyarihan ng tunay na pasaway? Nahuli ba ang pasaway? May nangyari ba sa mga lumabag sa mga panuntunan? So those are food for thought, and I'm sure Tita Winnie will agree that bawal ang pasaway kay Maring Winnie.
Thank you, Professor Nina. And maybe I would just like to go to Dr. Jonas, no? Doc, as a parent, as an educator, no, with all of these physical distancing and all of these online classes, as a parent and as an educator, how do you see this go on for quite some time? And how do you think can this be remedied or overcome? No?
Okay, I'm still a parent. I still have a couple of kids who are studying. I have an 11th grader in Ateneo, and he's doing the virtual or non-face-to-face learning. No? And I was observing him, and I was asking him, is it effective? No? He said that there comes a time that their attention span is not as focused as instead of being in the classroom. And then I spoke to a mother who's a teacher in grade school, primary school, and she was telling me that, Doc, napakahirap kunin ang atensyon ng mga bata. Just imagine from kindergarten, grade 1, grade 2. After a while, they're just all over the place. So clearly, this online learning is not as effective as being in school, physically in school. Now, I'm also a teacher in the UP College of Medicine. As you know, it is very important that our medical students are exposed to the hospital, being able to see patients, interview patients, touch patients, examine patients. So now it's all like education through Zoom, through webinars, okay? And we just wonder how long will they be doing this? How will they become very effective doctors that we will be sending out? The other thing that I have noticed is definitely this pandemic, because the schools are closed. One thing that was really eliminated is the socialization. Just like what our Dr. Castillo said, we are social animals. Iba yung being taught to you, you have lectures, but the interaction with teachers and especially with your peers, your classmates, kasama na dyan yung physical interaction. It's just very important in growth and development. So the other thing that was exposed was the inequality of opportunities. Where I was wondering, the daughter of our kasambahay who's in our house and is using our Wi-Fi, medyo magandang signal, but she's using her phone. And I was asking her, how can you actually concentrate if the screen is so small? How can you engage? So there are a lot of things. And I don't know about the long-term effects because we've been doing this only for a few months, but clearly I'm sure there's an effect in terms of learning per se, the cognitive aspect, the social development of everyone, the competence and skill that everybody's required to have, especially if you're a professional. I think the impact is much greater for disadvantaged families, those who are in the younger age group, because you need the guidance of teachers. even the parents are stressed, especially parents who are supposed to be working and now are being asked to teach their children. How about parents who are not educated? How do you expect them to teach? How can you expect them to teach algebra or geometry? Or so it's really a big problem and I'm sure opening of schools is something that we really have to take a look at. Right? Now, how do we try to at least decrease the damage of this? As a parent, obviously you have to support your child. You have to, one thing that was mentioned by a psychiatrist is napaka-stressful mag-aral ngayon. So as parents, you shouldn't be adding stress. Stress meaning I'm sure you're seeing your kids and you're trying to make sure that they're doing their homework. But I think you have to be more supportive. You have to allow them to make mistakes if they have to. But also stress the fact that education is much greater than just learning academically. There's a balance to it. So malaking bagay ang role ng parent. You have to be there. Right now, the parents, a good thing, there's some lockdown, so they have some time to teach their kids. But you also have to allow your children to relax, because it really is. There's already like a Zoomitis or a burnout on this Zoom or online learning.
Thank you so much, Professor Jonas. No, it's really it can also be very stressful talaga for the parents also. And I think my next question would be on the macro level for you, Sec Rosette. No, I mean, for example, here in Cebu, I've been working with several LGUs, and you can really see how the fragmented health system is not really suited for a pandemic response, no? Kasi iba-iba talaga mag-isip, no? There are different contexts and iba-ibang polisiya, magko-cross ka lang ng checkpoint, iba na yung mundo mo. So, my point being is, implementing all of these measures, how do you see that the DOH will evolve eventually to sort of be able to implement these measures in a more timely and more holistic manner?
Yes, thank you, Doctor. Actually, devolution has really shown weaknesses in our system, and it has fragmented it, no? So this is the divide between the national government and the local governments. And especially now that we are in this situation of the pandemic, it has emphasized, no, on this fragmentation. But if you try to look at what's happening right now, this is certainly a challenge for national government. We see, as you say, different interpretation of policies. We see different implementation of protocols. But the bottom line, if we look at it right now, we were able to enable them. And the bottom line is they are now leading. So when we see, and we have observed and noted that for one certain LGU, as you say, they would have a different standard or protocol that they are implementing compared to another. And when you cross the border, you'll get, when you quarantined already from one LGU, you get to have another quarantine period for this LGU because of this different interpretation and implementation of protocols. The LGUs now were given authority by the Interagency Task Force to have their respective declarations of lockdowns, declaration of additional protocols aside from what national government provide for them. And in this pandemic, we were able to highlight the role that local governments are doing and how they were able to lead and to protect their constituents. Now, how would the department evolve into this kind of setup and the challenge that goes with it? We can see from this point that we were able to strengthen our partnership with the local governments. We were able to see that we can be able to engage them with proper guidance and the protocols that we provide. And we can see that the local governments, no matter how different their interpretation and implementation of protocols are, their main objective is to protect the health of their constituents. And that would be the convergence of both national and local, that the objective would be the same, and that hopefully in the coming years and months that this divide between the national and local the gap between the national and local as to implementation, interpretation would be minimized, and we will be able to work more closely together. So this pandemic has given us that opportunity to work well with the local governments, and hopefully the advantages of why devolution was implemented in the country would be emphasized in the coming months.
Thank you so much, Yusek Rosette. No, Professor Monsod. Really, one of the problematic discussions, no, in various sectors is really the balance between buhay and hanap buhay. No, so can you sort of give some form of criteria wherein we can coexist? The two things can coexist. Ma'am, pa-unmute po. Pa-unmute po muna. Yan.
There is no inconsistency between buhay and hanap buhay. You have to have buhay in order to be able to hanap buhay. It's as simple as that. You have these political leaders of our country thinking that there is there is a trade-off, etc., and that the more you concentrate on the pandemic, the less you will have economic growth, and the more you have economic growth, the less you can work on pandemics. That is a dangerous and misguided thought, and it has been shown, I mean, scientifically, econometrically, that the relationship between buhay and hanap buhay is an associative relationship. They are not diverse. So if we take that away, and that is why we're saying, as a matter of fact, my colleagues are going one step further. They're saying that the buhay part is a precondition to the hanap buhay. Because you're talking only about anecdotes, paano kami mabubuhay, pa hindi kami makakatrabaho. That's where the government has to come in, because the government has to take a role while the pandemic the pandemic issue is being resolved. Now, I mean, I heard Undersecretary Vergeire saying that, wow, we've done so much. It's of course you have done so much, Undersecretary. You had a 181 billion peso budget for 2020. You have done so much. The question is whether you achieved the target you set out, and whether, as a matter of fact, you set out any targets at all. Because what we're trying to do is say, here are these people, we've got to do this amount. And if you did, well, we've done so. It's like our Philippine Development Plan. Beautiful targets, objectives, measurable targets and objectives. And the Philippine Statistics Authority has actually monitored these targets, but the government as a whole has ignored that. And what has the Philippine Statistical Authority found? It has found out that in most cases, I don't know what the number of targets are, etc., we have not done what we should do. But see, the government says, oh, we did this and we did that. Yes, you did this and you did that. Was that enough? Was that what you expected to do? And we don't get that kind of answer from our officials. That is unfortunate, because that's where we find out that we are falling back, we are falling behind. I cannot overemphasize the fact that we have to first do our health. And here I am among all of you doctors, and I'm the one that says we got to increase the expenditures for health, obviously assuming that the quality of the expenditures is okay, all right? That we're not being corrupt about it. But we have to do our expenditures for health if we expect to be able to get back on our feet. That has been found out econometrically. There is a scientific basis for that. And as a matter of fact, you look at the world data on COVID, and you will find out that the Philippines is one of the biggest contractions in the world, and the Philippines also happens to have very not very good statistics on health. And we're saying you've got to do that. So what has happened, Bryan? What has happened is that the budget of health has gone down from 181 billion to 130 billion, 131.2 billion. For God's sake, you should be screaming about it. But you know, this is my personal opinion. You've gotten so personally involved with the Secretary of Health, and you want either him to be removed or what, etc., that you don't care if the whole building falls. Nobody has actually said, "Hoy mga tao, bakit naman bababa?" Especially when we need it for COVID, we need it for contact tracing. You know that in contact tracing in the other countries, the contact tracing should be about 30 to 37 people in the urban areas, and in the rural areas it should be 25 to 30. What we're doing is something like 5. You cannot just do testing without contact tracing. Hindi ba? But nobody's talking about that. Why? Because I don't know why. There's no coordination. I have no idea. The fact is we have the biggest contraction in Southeast Asia, and we have one of the poorest records in health in Southeast Asia.
Thank you. Really food for thought. No? And we would want to hear some more from Professor Monsod later, but that is truly something that we should seriously think about.
Ay, nako.
Hi, Professor. I miss you, Professor Monsod. I miss you terribly.
Nako eh. Yung bang, my God, it's so evident what must be done, and we're not doing it. You know that letter from the health workers, that was a game changer, and yet at the beginning, Duterte was putting the health workers, kayo mga doktor, you said, you know, we got to lock down. You didn't say enough. You said we got to lock down and we got to contact trace, for heaven's sake. Yeah. That's what they have in Vietnam and Indonesia and Thailand.
Okay. Thank you, Professor Monsod. No, at this juncture, I would like to hand over to Doc Kat, no, for the next theme for tonight's discussion. Doc Kat. Pa-unmute po.
Thank you, Bryan. So we move on to the detection part, which is, you know, one of the Professor Monsod already alluded to this earlier with regards to detection and contact tracing. You might all be wondering why Dr. Del Rosario is representing the patient group in this discussion. So, Dr. Del Rosario, can you share with us your personal experience with COVID, your thoughts and sentiments when you developed symptoms, and any apprehensions that you might have had surrounding testing and hospitalization? And, you know, if you want to share other information you gathered from your conversations with other patients, then please feel free to do so also.
I got involved with COVID-19 operations being the spokesperson of PGH. So initially, I was basically telling the media what's going on with our operations, getting involved with healthcare workers, trying to get their sentiments, also trying to relate to some local government officials trying to work on quarantine centers. So I read a lot about COVID-19, and every now and then I get to advise the public on what to do, how to protect themselves. And about 4 months into the operations, a significant tragedy happened to my family, where my almost 90-year-old father contracted COVID, and then he spent his 90th birthday in the hospital. I even talked to him and told him, Tay, ikaw ang pinakamatandang COVID patient ng PGH at ikaw rin ang makakalabas na pinakamatanda. Right there and then, I already saw what a patient who goes into the COVID wards, that dreaded COVID facility. It is an isolating disease. You are by yourself, regardless of your age. Pwede siguro ang mga bata, payagan yung parents, there's a waiver. But for the majority of patients, you are on your own. So I decided to don the PPEs, and for the next 2 weeks of my life, I was spending time with my father, aware of the fact that I'm probably exposing myself to the COVID-19. So to cut the long story short, my dad got admitted. I was going in and out of his room, trying to make him feel that he's not alone. Because for one thing, the effects of COVID in your physical body is well known. It affects your lungs, your heart, your brain, your kidneys. But one important aspect of the disease is the mental or psychological aspect. So I was there for him. Then my mother got infected as well. My dad basically exposed her at home. So about a week later, my mom got admitted and she was sicker. She went eventually to the ICU, got intubated. So all of these experiences now, as I try to perform my job as the spokesperson of PGH. And so for the next 2 weeks, I was donning and doffing. I was feeling the physical effects of being a frontliner. And then the next thing I knew is now I'm getting COVID myself. I got admitted. I was told, sir, you have to get admitted to PGH. At that time, I was having respiratory distress already. They said my viral load was high, and so I had to come in. So that we were at one time in PGH, the three of us on one floor, rooms apart, and I was also battling the disease, trying to. So what goes on when you're a patient? A lot of things. The first thing, in fact, I wrote a jingle about mahirap magka-COVID, but basically what happens is once you're tested positive, RT-PCR positive, ang una mong maiisip, Diyos ko po, paano ng pamilya ko, no? Nahawa ko ba sila? Paano na ako? What will the people think of me? The stigma that comes with the disease. So you come in, you are a patient, you worry that you might not make it because every now and then you hear stories of doctors, patients, ordinary people, those with comorbid conditions not making it. At the same time, you do know that there are no proven treatment, that all of the things that you're getting in the hospital are all experimental, really. And then you see conflict, some knowledge that some people are advocating hydrochloroquine, and then you'll hear some camps say, so much uncertainty, basically. My parents did not make it. It was a personal tragedy. Both of them died of COVID. I was lucky enough to survive to be able to tell everyone of the COVID experience. I feel that I'm a better physician now because I became a patient. I know how it feels. The other thing that opened my eyes is really how hard it is to be a frontliner. Frontliner really inside the ward. There is a rule that you try to limit your contact for about 15 minutes because beyond that, you might be exposing yourself. So I can feel the anxiety, the stress level of the doctors, the nurses. So they want to engage with you, but they're also trying to protect themselves. So you can actually feel that there's some distance. Compassion is very much needed in this patient. I do really appreciate the fact that they're trying their best to reach out to you. In PGH, what we have done to help the patients is we made this Telekomusta program wherein our indigent patients will have a chance to talk to their families by looking at this laptop. We put them at bedside, we connect them to some kind of a Zoom, and daily they get to talk to them. Connection is very much important being this. Lastly, I would like to say when I talk to the healthcare workers, really 3 fears stand out. The fear of getting the illness, the fear of passing on the illness to your family member, and the third one is really the stigma of the disease. People do not, sometimes they're already recovered, they're still worried that people might, you know how it is. There was a time you have to be RT-PCR negative to be sent home. We had one story that we end by. We had a story, a very inspiring story of a kid, a 9-year-old kid who has been in the ICU for COVID. And after about a month in the hospital, he made it, and we actually covered his discharge. Everybody was clapping, everybody was happy, and we featured that. That was it went viral. You know, like trying to inspire people that you can actually recover from COVID. So that eventually was shown on television. It was covered by, it was picked up by GMA, by ABS. And then the next thing is this family is being ostracized and being discriminated in the communities.
Hi.
Instead of like rallying and being happy, the brother called me up and told me, "Sir, sana po hindi nyo na lang pinalabas yung nangyari sa kapatid ko. Dahil ngayon po hindi na kami pwede lumabas. Sabi sa amin, wag daw kami gala ng gala." So you can see the stigma that comes with the illness. So we had to go to the community, explain to them that this child is already COVID-free. And they just said, "No, Doc, kasi nag-iingat lang po kami." No? So really we need to educate the mass of the people of what COVID-19 is. Mahirap magka-COVID, no? Talagang mahirap. And lastly, financially, thank God may konting coverage and PhilHealth, but you can really spend so much once you get admitted to COVID. And that's the reason why people are so afraid of having COVID. And this fear sometimes will cause people to act illogically, unkindly, and then ito na nga, pati yung mga quarantine protocols na yan, it's brought out by fear. Kahit sabihin na namin 2 weeks na naka-quarantine, some LGUs will still demand, "No, we want our own RT-PCR, we want our own quarantine protocol." So that's basically my experience with COVID. We protect our healthcare workers in PGH. We promise them that at least we are sending them to war. At least we'll give enough protection and try to take care of their needs. Thank you.
Wow.
Thank you for sharing your experience, Dr. Del Rosario. Yusik Vergeire, what is the DOH strategy in terms of dealing with stigma like this after recovery? Or for some patients, it's good to hear that for Dr. Del Rosario, there was no hesitancy when it came to testing and hospitalization. Maybe because, he's a physician and he knew that he had to be tested and had to be admitted to the hospital. But then, we see so many Filipinos being afraid to get tested, being afraid to be hospitalized. What's the DOH strategy to address these, ma'am?
Yes, ma'am. Thank you for that question, because I think this is very important. We've experienced this discrimination and stigma, especially for our healthcare workers during the early part of the pandemic. You might have heard one healthcare worker being sprayed on, or tinapunan siya ng bleach on her face, and she was discriminated. So another one was another healthcare worker asking help from us, pinaalis siya dun sa kanyang tinutuluyan na apartment. So this kind of stigma and discrimination were really unacceptable, especially that these were the healthcare workers who were taking care of all of our patients and having this kind of life because of the pandemic. So immediately, risk communication, that's what we did. And then we engaged our local governments. And then we also referred this to the Department of Justice so that there might be some form of sanction for these people who are trying to discriminate people who have had COVID or who are just working in the hospitals. So that was what we did. And it's a kind of a good indication, because right now we seldom hear of people being discriminated, especially our healthcare workers. Although the fear is still there in the community, I agree with Dr. Jonas na talagang ang isang LGU nagawa na nga lahat ng test o na sabi ng COVID-free na ang pasyente, pag uwi pa rin, i-require pa rin ng another 2 weeks in spite of the doctors clearing the patient already that they are already COVID-free. So that is one inefficient way of dealing with things because we spend more resources by doing that. What we do and what we implement would all be science-based. Meron po tayong mga ebidensya na magsasabi na hindi na kailangan mag-test after this number of days that you have quarantined. Pag sinabi na ng doktor, wala kang simptomas, you are free already. But, then again, when you get to the LGU, they would still require. So, isa yan po sa challenges natin ngayon. Pangalawa, yung sinasabing mga nagkakaroon ng hesitancy regarding testing, meron po tayong batas ngayon, yung RA 11332. Actually, also in the middle of this pandemic that we are facing right now, marami po ang nakakapagsumbong sa amin ng mga local governments. They're having a hard time convincing people to have themselves tested, especially when they are with symptoms already. So unang-una po, may batas tayo. Sinasabi ng batas, because of public health, the government can enforce kung ano man pong kailangan na strategiya para naman magkaroon tayo ng control dito sa transmission nangyayari. Pangalawa, I just like to inform everybody that in our protocols and still based on evidence, it is not really testing per se that would solve everything. Kami po ngayon ay nag-shift na to this isolation first approach. Ang nangyari po kasi, people had that kind of thinking that when you get tested, you're okay already. Officials had that thinking also that when you test everybody and your problem has ended already. But it's not, di ba? Alam po natin, ang test is a one-time event. You are all clinicians here and you can tell me, di ba? I test you now, tomorrow you get exposed, you can have the disease again. Mm-hmm. So kami po, nakinig sa ebidensya, nakinig sa aming mga eksperto na nagsasabi na, let's shift more to this isolation. I-isolate mo na yung mga tao, whether they get tested or not, basta naka-isolate sila, and then you will not be able to transmit the disease. So isa po yan sa amin pong pinapakalap na impormasyon sa ating mga local governments, sa ating mga implementers. That, yes, testing is critical, but you need to isolate the patients also first before you have them tested. And always remember and always remind them that testing is a one-time event, that you get tested now, pwede pa ho pagkatapos ma-expose at magkaroon uli ng sakit na to kahit nag-negatibo ka na. So for those who are hesitant for having themselves tested, una-una may batas po tayo. Pangalawa, nakikita po namin, base sa pakikipag-usap namin sa local governments, these factors that affect itong hesitancy would be the same factors that Dr. Jonas has mentioned. Yung takot nila na ma-discriminate dun sa kanilang komunidad, yung takot nila na kapag tinest natin sila, kukunin natin sila sa pamilya nila at dadalhin natin sila sa quarantine facility. And these were the things that we had so much discussion on, kasi yung home quarantine versus the community quarantine facilities and all. So with this, the Department of Health frequently explains to the public through our communication platforms that the test would be so important, especially if you have symptoms. The test would be so important if you are a close contact. The testing is not really important and not required if it is just for screening, like border screening, screening for work and all. We recommend the symptoms-based screening when we do this. But of course, for those, as I've said, I again repeat, for those with symptoms and those with who are close contacts, that is where we really recommend that testing be done, and it should be enforced by the local governments.
Does that mean, Yusek, sorry, can we just ask, does that mean now that we are getting away with asymptomatic mga OFW who are just coming into the borders and they are asymptomatic anyway, that they will be screened pa? Wala nang ganyan?
No, sir. We still have that screening and testing when it comes to OFWs at the port of entry. We still do that. But when it comes to when they go home to their provinces and they are released already, the LGUs would have their own protocols as we have observed. So the LGUs, most of the time, they would still require testing for these OFWs because it has been their experience that many of those who turned positive in their communities were these returning overseas Filipinos. So they still have their testing at their borders. But for that's for OFWs. What I'm trying to say would be these interzonal movements where there are requirements still that people should get tested. Even you're traveling from one place to another, Metro Manila to Bulacan, they still require this. So I think that is a waste of resources of it.
How come we cannot enforce that easily? I mean, how come there's still these inconsistencies between different municipalities or cities?
Well, it's the local government units authority over the health of their constituents. And that's part of the devolution. And the national government can be able to enable by providing protocols and policies, guide them. And then when it comes to implementation, and they would be interpreting it in a different manner, implementing it in a different manner, all that we can do is ask the ILG to guide them further. But for that, the authority lies on the local government units.
Thank you so much, Yusek Vergeire. So maybe the challenge here really is how to, with a devolved system, how to make sure that all the LGUs are aligned in terms of implementation and interpretation of the DOH guidelines. And even employers and companies are also screening and testing programs which are against which go against the recommendations of DOH. So we recognize that it's really a challenge for DOH and other government agencies to regulate this. May I turn you over to Bryan for the next section of the discussion?
Yeah, thank you so much, colleagues and panelists. No, the next segment will be about mental health, and my deepest condolences to Dr. Jonas. No, I myself, my parents contracted COVID, and I lost my dad to COVID also last June, and I could understand the tumultuous, the roller coaster of emotions. No, especially for example, me that I'm directly managing COVID patients, and I isolated my parents since March, and I haven't seen them, and then. Truly, when the mental health of health workers is something that we really need to address. No, I mean, personally, I have felt so many emotions during that time, but I went back to work after my dad was cremated because there was just too many fires to be put out, no? And too many patients that need our care. So, is there any mental health, mental wellness issues? I mean, are there any initiatives in the Philippine General Hospital to address the mental health concerns of employees?
Bryan, condolence. I didn't know that you lost your dad too. But yeah, one of the things that the COVID-19 Center, PGH, is primarily being run. Our frontliners, the ones who are really on the front line, sumasagupa sa virus, are mostly our trainees, residents and fellows, young consultants. No, we try to protect our older senior consultants. So parang mga anak na natin yan. And then of course our nurses, nursing aides, other support staff, they're also very much involved, our technicians. So we learned early that there are mental or psychological issues. There was even a study by a neurology resident in PGH recently presented of the prevalence of burnout in this COVID-19 pandemic as in a neuro resident, as much as about 80% have this feeling. And then I was looking up globally the prevalence of mental problems, anxiety, even the feeling of trying to end your life, very much stress, as high as about 20 to 25%. So we learned early that we have to address this issue. So what we did was, in the Department of Psychiatry in PGH had this parang hotline. If you have any issues, that's one. Of course, some might not be willing to open up. So we would also ask their colleagues, the department chairs, to be very observant and to make sure that the troops are actually okay. So we have that program, some kind of counseling. We also have a very active tele-chaplaincy. Yung aming parish sa PGH, the parish priest is into spiritual counseling also kasi malaking bagay yun. So we do address that, no? We try to ask what's really bothering them, no? Again, fear, anxiety, no? They don't want to get infected, they don't want to pass it on to their families, the stigma. But you know, one other thing that they said was this constantly seeing people dying. The way that COVID patients die, parang they're isolated.
Yes.
They couldn't even like touch the patient. You know, siyempre, it's just but normal, very Filipino. Pag namatay ka, mayakap mo, hindi ba? You're wearing this PPE, your level 4 PPE, you are behind the mask, that face shield, that it's so hard to, you know, your emotions are there. It's so hard to express them. Couldn't even tell the family because they're not there to see you. So it's just a patient who eventually goes to the morgue. So there's an element of guilt, feeling that you have not done enough, feeling that you have not examined the patient long enough, feeling of not being able to talk to the patient long enough, showing the compassion that we're used to. So marami pong issues, no? May mga iba po kaming residente and fellows who would like to quit. There was one time that they really expressed they're so depressed. They feel like wala na tong katapusan, no? So we're aware of that. We have provided programs to address these issues. And if there are some residents and fellows who feel like they're really overburdened by this, we give them the freedom to take a leave if they need to.
Thank you, Dr. Jonas. And I would like to ask Dr. Nina Castillo-Carandang, no? As a sociologist, ma'am, do you have any tips or a framework that we could use if ever we're going to counsel or approach our healthcare workers who need this mental health support?
Thank you, Bryan. Nakikiramay din ako sa iyo. Hindi ko din alam na wala ka ng isang magulang. Kay Doc Jonas din, ano? Ang aming pakikiramay din. Doc Jonas, a large tertiary hospital in our Bopis area, you know where that is, and you probably know which hospital I'm pointing out.
Yes.
Approached me as early as May, because they were already noticing burnout among their trainees.
Right.
Their trainees were being asked to do triage in the parking lot.
Yeah.
Rain or shine, baha, etc. So I helped them. I was surprised when they reached out. Sabi ko, sige, I just wanted parang to monitor. So they made parang a app on the phone where the staff can say, I'm happy today, I'm sad today. So parang emoticon meter. Okay, that's what I suggested. Simple lang. Then when that happened, they wanted me to do via Zoom. Sabi ko, no way am I going to do this via Zoom. And I can't travel to Manila. I live in Los Baños. Sabi ko, can you please get professional help? And I pointed out many resources to them na libre. Please note that there are many free resources professionally done which are available. So for example, Doc Jonas, nahihiyan lumapit sa psych natin. Marami pang free mental health services by a professionally trained psychologist na pwede silang mag-access. And there are even groups sessions which are offered. No? So then I kept on following up the hospital. I will not mention which one because I was concerned about their trainees. And then finally they got back to me, sabi, ma'am, we have X number who are clinically depressed, X number have anxiety, X number have burnout. Kasi I insisted, please have them assessed professionally by your attending psychiatrist. I cannot do that via Zoom. No? And nor am I qualified to do it. And then they got back to me, so what do you want to do now? I threw back the challenge to them. Kasi now that you found out that there are mental health problems, do you want to do anything about it? So I threw back the problem at them again. Ang tagal sumagot. Finally, they said, we're going to have our own for all of the staff. I followed up again. Sila nag-initiate ng contact, hindi ako. I followed up again and asked them, ano na po nangyari? They didn't answer my query anymore. So I'm really concerned about this Ningas Kugon attention to mental health. It's a real problem. And we can't just be reactive to it. So I'm happy that PGH, for example, has put in a wellness program. And I know for a fact that UP Manila also has this wellness program for faculty and staff. A few years ago, one of the doctors who worked with us in a project killed himself. So this is very personal to me because a young, brilliant UPCM graduate kills himself. Bakit? Di ba? And this wasn't even COVID yet. So we have that happening. So yun ang ano ko, if we're going to have a mental health program, I suggest that all trainees receive a baseline assessment. Confidential, private, anonymous baseline assessment. That's what I suggested to that BOPIS hospital. And I asked them, please devise a special individualized plan of action for each one of the trainees who needed assistance. I don't know if they did it. They haven't been very responsive. So I'd also like to encourage probably PGH to do that. We have the resources to do it anyway, have the expertise to do it in-house. Baseline and then an individualized plan of action for those who need help. So that there's no stigma. Everybody will get assessed. Okay, so even I would be willing to be assessed as a consultant and a faculty. So if it's across the board, there's no stigma in being assessed for potential psychosocial problems. And then an individualized plan of action. For the general audience here, it's really hard. As I said, we're social animals. So we want to strive for social connectivity while remaining physically distant. That's really hard. Bryan and Kat know very well, and even Yusek Rosette know that I like face-to-face interaction. That's why I'm a social scientist in the first place. So that's hard. There's also so much noise, discordant and disrespectful voices. Social media, television, radio, wherever. So we also need to step back and enjoy some quiet time. We've forgotten how quiet things can be. We also need to be more self-aware and attuned to how our family members, friends, and colleagues, neighbors are doing. We have to ask, kamusta ka? When I actually ask my colleagues, I'm not a clinician, I ask my colleagues, kamusta ka? Tuwa sila, sasagot sila kaagad. Naku, I'm so happy you asked me. And they just share what it's been like, no? I sometimes ask Bryan, oh, so how are you? Kaya pala matagal ka sumagot, Bryan, kasi may nangyari sa pamilya mo, no? Because I also ask Bryan. And my lessons are never take things for granted, people for granted. We need to nurture our faith. And I've said this in a talk I've had with Yusek Rosette. It's okay not to be okay. Hindi na po siya nakakahiya. Dapat. If we make it something that we talk about all the time and embrace as part of our hopefully better every day. A greater acceptance of mental health problems, greater availability of resources for people who need them, and everybody should have a check. Let me switch to something personal. I've been in the house since March 10, so I'm like Tita Winnie, seldom go out. And there are times when I ask my husband, nabubuang na ba ako? So, and then my husband says, okay, let us go out and let's take a short drive for you to see the outside world. Kasi I'm a high-risk patient, so I seldom go out. Alam ni Bryan yan, nag-alaga yan sa akin nung kasakit ako. So, when I ask that, nabubuang na ba ako? My husband say, okay, time for us to go out. You need to see the outside world. And the first time I rode in the vehicle, I got car sick. Because I haven't ridden one in months. I haven't gone outside of the house in months. So, totoo yun na you have to be self-aware and you have to ask questions like I asked my husband, nabubuang na ba ako? Thank you.
Thank you so much, Professor Nina. Doc Kat, for our very controversial and final theme for tonight. No? Doc Kat, are you there? Okay.
Thank you, Bryan. I think I'm having problems with my bandwidth. I would like to go back to Dr. Rabi, please. From all the problems that we have right now, the one saving grace that people are really clamoring to get is the vaccine. Do you think that, in terms of fearless forecasts, what can you say, Dr. Rabi, about vaccine efficacy and availability?
Well, we live in hope, but I don't want, as we've been saying, it's optimistic hope that we will eventually have a vaccine that is safe and effective. We have been encouraged by the recent announcement by manufacturers, and I reiterate the word manufacturers. They still need to be validated independently, and they need to be looked at how they perform in real settings as opposed to trial settings. So, but the news coming out from multiple manufacturers is encouraging. But having and safe and effective vaccine is not just enough. We need to make it accessible for everybody who needs it. And answering also to one of the questions, WHO has developed a prioritization list, which the DOH has adopted. We know that the DOH has signed on to the COVAX initiative, through which the government expects to access at the earliest 20 million doses. But the eventual government plan, as Carlita Galvez has mentioned, is to access 60 million doses for the Filipino people. The question is, how soon can we get that safe, effective, and effective vaccine? How costly will it be? How do we get it to where the people are who will need it? How do we convince the people that that's the best solution? So there's many unanswered questions. It's still a long way away. We have an intensive period ahead of us as we prepare for rollout of potentially effective and safe vaccines. But that road is not easy, and we shouldn't take it for granted. And so I go back to my old mantra. We can do a lot without a vaccine. We need to do that. Many countries have done and shown good results. We need to do that in the Philippines.
Thank you, Dr. Rabi. Yusik Vergeire, there's a sentiment that the country is still trying to get over from the Dengvaksha experience. What are the steps in place to prevent another Dengvaksha-like scenario or fallout with regards to this COVID-19 vaccine, ma'am?
Well, first and foremost, we have tried to make our processes more robust. Before, we only have the Food and Drug Administration that would be trying to evaluate the vaccines or the technologies that comes in the country. Right now, we have added another layer wherein we have identified and created this vaccine experts panel. We have identified individuals who are expert in the field of vaccinology, and they are the ones evaluating the dossier and the different results of the trials of these different vaccines. So the vaccine experts panel had been is being overseen by the Department of Science and Technology. So this would be our initial step prior to the FDA evaluation. So we made our regulatory process more stringent so that we will be able to evaluate properly and ensure that only safe and efficacious vaccines would enter into our country. Another thing would be we have been engaging and trying to mobilize the communities ever since WHO have committed to us that we will be starting the solidarity trial for vaccines. So we were able to sit down already with the identified local governments, and we were able also to initially engage the community. So I think this is one of the things that has to be done so that we can effectively inform people of what this technology will be provided by government, and also what would be the advantages and disadvantages to each individual. And we also are employing the informed consent principle, the informed consent, wherein we are going to get informed consents from all individuals that will be provided by this vaccine. Another thing that we have done would be to enter into as much as clinical trials that we have currently. So we were interested in accepting clinical trials from the manufacturers. So we were more inclined into these clinical trials, although we cannot prevent bilateral partnership and individual manufacturers offering their products already. But clinical trials would give us that opportunity to try it out, especially in our population, because we all know that the vaccines may work differently among the different races. So we wanted clinical trials also to be done here in our country. Also, we have developed this database where all of this is a system where all of those to be provided with the vaccines would be encoded here, all their details, so that there would be easy surveillance, post-monitoring surveillance, so that we can easily track the progress and the developments among all of those to receive these vaccines that we have right now. So these are the things that we are ensuring and included into our system so that we can ensure that everybody will be safe, and we will have a safe implementation and deployment of these vaccines.
Thank you, Sec Vergeire. We are running out of time, but I would like to ask this question to Professor Monsod. Considering all the social mitigation strategies that we have right now, all the distancing, stay at home, and all this, how do you plan to celebrate your Christmas, po, Professor? Ma'am, naka-mute po kayo.
Professor Monsod, unmute po. Yeah,
I said, right, sorry. Right now, the only ones who can come to my house are my children and my grandchildren. But these children and grandchildren are themselves isolated. In other words, they don't go anywhere. So there is no possibility of somebody getting contaminated elsewhere. My grandchildren are schooled at home, so they don't go out. So they come to me, and we have done well so far. My daughter, Dr. Monsod, who is the one that wrote this paper on the Philippines' performance with respect to COVID and growth. She's the one that gets very angry at us because we are congregating all the time. But I am sure that these kids, my grandchildren, are not at risk, and my children are not at risk. Their maids have not gone out on day off. Terrible. But they're the ones that are afraid to go out on day off. And our maids don't go out on day off. The only possible contact with the outside world is our driver. And I try to keep my mask on when I talk to him. That's it. So we're like a cocoon.
a bubble.
But I would like
Professor,
to ask,
did you ever imagine, ever in your whole life, did you ever imagine that you will undergo this type of experience?
Well, I mean, I am too young to have experienced the the Asian flu in 2018. I may look old already, but I did look up the stories, and that was pretty bad. And even then, people were already wearing masks. So I cannot understand why masks, especially in the States. I mean, we in the Philippines, you're talking about pasaway ang Pilipino, mas pasaway ang Amerikano. Diyos ko, everybody I see is wearing a mask in the Philippines. At least in my barangay, in everywhere I go, I see them, they're wearing masks. I do not wear a mask when I go out, but when I go out, that's when I go out in the morning, that is to walk. And that is at 5:30 in the morning to 7 o'clock in the morning. And I don't see very many people. So my mask is off. And then when I see somebody coming, I put on my mask. I'm thank God I'm doing all right. But I wanted to ask a question of the Undersecretary. Undersecretary, sino ba ang nagtra-trial ng vaccine dito? Mga Inchik ba o mga Moderna, etc.? Because I tell you, I mean, I'm afraid of those Chinese vaccines.
Yes, ma'am. Apat po
Sorry, I mean, if anybody is Chinese, I'm sorry, but that's how it is.
Yes, we already have 5 applicants for the clinical trials, and one of these 5 applicants would be the Sinovac from the Chinese government, and
the
these
other
Sinovac,
4,
and the other 4 would be the AstraZeneca, the Clover, the Janssen, and then the Gamaleya from Russia.
So Russia, Russia, China.
US.
Yes,
Who
Janssen.
are the other 3 suppliers?
AstraZeneca, that would be from the United Kingdom, and then we have the Johnson & Johnson product, which and the Clover, which I think is from Australia.
And how long will these clinical trials last, ma'am?
It will depend on their protocol, ma'am, but usually it is going to run for months. It's not going to be short.
So after those clinical trials, then and only then will the vaccine be approved?
Yes, ma'am. But there are already some bilateral partnership and individual manufacturers which are offering their products to us because they already are in their advanced stages or in the latter part of the stages of phase 3 clinical trials. So once they get their emergency use authority from their country or from the other countries, they can very well apply in our country also.
I guess the bottom line is for the Filipinos, when is the earliest time that we can get vaccine on a mass production or a mass distribution basis?
Yes, based from our negotiation.
Okay, that's the last question for you, Secretary.
This is very important kasi
Please go ahead and answer.
Yes, that's the last one. That's the last one.
O, diba, hindi ako nagtatanong ng question dahil na ako nagtanong.
Okay lang po. Okay lang po.
So
please go ahead, Dr. Vergeire.
Yes, ma'am. Based from our discussions and negotiations and based from the forecast of our vaccine czar, we are looking at hopefully by the first quarter, last month of the first quarter, we'll be able to receive already these 2 vaccines that we are eyeing. That would be the very first that can be allowed to enter into the Philippine market. So
by March, and how much will these vaccines cost?
We are still under negotiations, ma'am. I cannot disclose the amount because we have confidentiality disclosure agreements, ma'am.
How much have you set
thank
aside?
you so much.
Department of Health. I want the Department of Health. How much have you set aside for vaccines?
We already have now about 8.5 billion pesos. At the initial, it was just 2.5, and then the legislators have added additional. And then there were also commitment coming from the Senate and the Congress that there are still other funds that we can also access aside from that. Aside from that, we have the multilateral partners.
Okay.
Thank you.
Thank you. Thank you for allowing me to ask
Yusek
questions.
Vergeire. So that is, it's good to end on a promising note. Thank you for the questions, Professor Monsod. And let us just remember that, the vaccine is not a silver bullet. It's not possible to get injected today and take off our masks tomorrow. right? It doesn't work that way. So
Well,
we
I just
really
wanted to tell you on the last that the Merck people are very, very, they said this hype about the vaccine and the pressure to bring it out is a grave disservice to the countries. And I think we should put that
Yes,
in
and
because
that is
Merck,
the reason why we need to really manage our expectations.
yeah,
I think
nobody is talking about what the side effects of those vaccines are. Are you going to be the first to take the vaccine? If the vaccine were ready, may I ask from among the panelists who will offer to be the guinea pig? Nobody, because I'm not. No, I will not.
Yeah.
Natakot ako eh.
Professor, yeah.
Bryan,
I think,
Bryan and I have antibodies, hopefully, no, Bryan?
I think we should wait for the trials and there's the disclosure of their safety, safety reports.
But Pfizer and Moderna have given all this hype, and they're the ones that are giving it, and we're all buying it. There's nobody there's no objective outsider who has come out with anything, and I am so scared. I mean, Obama has offered to to take the vaccine, and Duterte has offered to take the vaccine, and Clinton has offered to take the vaccine, and I don't know why they're doing that.
I think Professor Monsod has just articulated the title for our next symposium. No, I think there has to be, this cannot just be the last 2 minutes, Professor Monsod. No, we need to talk again. Huh?
Well,
this cannot be the end of it.
I was waiting for this question to be brought up kanina pa.
Yes, okay. Yes, thank you so much, Professor Monsod. Let's have another session, definitely we will have. No? So I think on behalf of the Philippine Society for Microbiology and Infectious Diseases, your humble servants in this pandemic, no, we would like to thank our esteemed panel for this very informative and comprehensive multi-sectoral discussion. No? And truly, our symposium have been enriched by your experiences and your insights to this pandemic. So with that, we would like to end this session with a very good evening and God bless everyone. Thank you so much.
Wow, alas 7 na pala.
Alas 7 na po. Next session.
Thank you.
Thank you
God bless
very
po.
much.
Thank you very much.
FPSMID.
I enjoyed.
Thank you very much.
Congratulations,
po.
FPSMID. Thank you.